Abby, thank you so much. And huge welcome to everybody and to all of our speakers and to Lynn Featherstone, the Minister from DFID. It's great to have you all here. I'm really delighted that we're holding this meeting because it really seems to me that the crisis that we're dealing with in the region brings together two huge development challenges. One is the regional challenge, that we've got a group of the world's poorest countries with the least developed health system trying to cope, with this shocking epidemic. But I think it also tells us something about our inability at the moment, or the weaknesses of the multilateral response mechanisms that can contain these crises before they get out of control. And I think it reflects our underinvestment in the global public good, which is health prevention, disease mitigation and control when these crises occur. In terms of the regional response, I was very struck by, Abby, as you say, when you read about this crisis, that the numbers are just horrible, but the one that leapt out for me is the exponential rate of increase. And I think I'm right in saying, in fact, I think it's from a speech that David Nabarro gave, that the infection rate is doubling every 21 days. And if you project that forward to about January, you've got 500,000 cases. And much of the response so far has been through these chronically underfinanced, under-resourced health systems. One doctor for every 100,000 people in Liberia, 970 trained nurses in the whole country, less than $100 per capita spent on health, which is probably less than the average American or European spends on aspirin or ibuprofen in a year. So, these were systems which were ill-equipped. The international response was clearly too late. The emergency was declared in the region in March. MSF was declaring the emergency in March. It took until August for the international community to get together to recognize that it was an international public health emergency. And even now, according to Margaret Chan's figures, we've got 1/20th of the resources in place that we need to deal with the problem. So, I think there are issues of coordination, there are issues of financing, and above all, there are issues of urgency. This is, one of these crises where every day's delay carries a huge cost for the health systems of the countries concerned. And the final point I wanted to make actually was, I think it's increasingly evident that the real barrier, the most effective mechanism for controlling this type of outbreak and responding to this outbreak is a properly financed and functioning public health system. And one of our concerns at the moment is that there are 2.5 million children who are living in areas affected by Ebola where health services have collapsed. And these are children with very high levels of child mortality, death rates from measles, pneumonia, and so on, and the health systems aren't able to respond. So it seems to me responding to the crisis, developing the long-term interventions that will enable these health systems to become more resilient. And I think to move towards what Larry Summers described as this agenda for health convergence. We need to reduce these glaring health disparities between rich countries and poor countries. I'm very glad actually that we have some ODI staff, both from our fellowship program and our budget support initiative program, working in Liberia, and we'll certainly be looking to scale up. And my hope is an expectation actually that we'll be learning an awful lot from today's proceedings. So huge thank you to all of you for being here, to our speakers, and I very much look forward to hearing about the outcome of the meeting. Thank you.
Thank you, Kevin.